Is second day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NISHANT Kumar Srivastava. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, International Forum for Promoting Homeopathy is doing regular sessions from 7 to 10. We have 3 sessions, 7 to 8, our Hindi session, 8 to 9, our international session in English, and 9 to 10, local language session in Malayalam. Today, our guest is Dr. NISHANT Kumar Srivastava, who has completed MD Homeopathy, then PhD and PGDEMS and IPTC Pune, and is a consultant in Ministry of Women and Children, NIPC, Lucknow. He is a honorable guest lecturer at Solanki Homeopathic Medical College, Shimla, Himachal Pradesh. He is a multi-specialist. As you all know, that most of the homeopathic doctors are multi-specialist, but he has some special interest in skin, kidney, and renal disease, psychosomatic, psychiatric problems, arthritis, pediatric, and he is a winner of many awards, and particularly the Bharat Homeoratna Award 2023, Hanuman Award 2023, Homeo Gaurav Samman 2023, Homeo Icon Award 23, Rashtriya Yuva Gaurav Samman 23, Dr. Shekhar Tandon Award 22, Karambir Award 2020, and Dr. Nigam Memorial Award in 2019, and Dr. Hemant Banerjee National Award in 2015. So such a wonderful personality is with us, and sir will be discussing about the evidence-based clinical study of psoriasis. As you all know, psoriasis is one of the area where homeopathy doctors can do wonders, and Dr. NISHANT Kumar Srivastava is an expert in this field. So let us welcome Dr. NISHANT to this stage. Welcome, doctor. Please unmute, sir. Please unmute, sir. Please unmute. You are muted, sir.
Is it fine?
Yes, yes, it's fine.
One second, I'll just...
Sir, we will admit all the people. Sir, you can go ahead with don't mind about all these things.
Yeah.
Because being a co-host, it will be there in your friend, but...
I'm visible? I'm visible?
Yes, everything fine. Everything fine.
It's fine? Okay.
Everything fine. Everything fine.
I'll start. One second. I can't see...
This slide.
Yeah, no, slide, no, I can't see the...
Screen.
Yeah, screen is not visible to me right now.
Because it is a big...
Is it okay?
Yes, yes, the first page, evidence-based clinical study of psoriasis is there.
Right. Yes.
Yes.
Yeah. So, hello everyone. Very good evening to everyone and all my teachers. My gurus are here. Dr. Sahani sir is there. I welcome. I do him Charan Sparsh. He's a guru. He's a mentor, and he has always encouraged me from doing all the researches, especially on dermatology. And today he has given me an opportunity. An international forum of promoting homeopathy, IFPH, is doing a tremendous work. And I start this session with on psoriasis, which is very important, which has always been very important in my clinical practice. When I see psoriasis patient, vitiligo patients, especially autoimmune diseases related with dermatology, day in and day out, and I have worked on dermatology for very long. As I've always last time also I presented a presentation on the dermatology. So today there's a specific topic that will be talking about is psoriasis. And we all know psoriasis is a great challenge. It is an autoimmune disorder, and most specifically, I have to tell you that that psoriasis has got best treatment in homeopathy. Let us be very clear about this. I always say that where other pathy stops, homeopathy starts from that very place, especially in autoimmune disorders like psoriasis, like vitiligo, like SLE, like rheumatoid arthritis, and yeah, so on and so forth. So the basic thing I want to reiterate is treating an autoimmune disease is always a challenge. Okay. So first thing is, don't limit your challenges. Always challenge your limits. That is important. We all know that autoimmune diseases are a big challenge, but homeopathy has got very good answers for autoimmune disorders, especially psoriasis, that we will see today. Okay. And we all know that body and mind, there's a fine equilibrium, a balance between body and mind, which is also called as a vital force, that we all talk about. And body and mind are so important. Even our Hahnemann sir has given so much importance in the organon of medicine about the mental origin of the disease, psychosomatic disorders that we talk about. And presently, the modern medicine has started recognizing psychosomatic disorders, which our master Hahnemann sir has already given it everything in our organon of medicine 280 years ago. Okay. So our organon has already always given the importance to mind, and mind has always been, because of the emotions that we underplay. There is always a emotion. There is always a emotion. There's always a stress that deals with, and that organ which deals with our emotion is limbic system, that we all know, which controls our emotion, produces feelings. Okay. And this is what gives rise to, if there is any disorder, it gives rise to an autoimmune disorder because of imbalance of hormones. All emotions, every emotion has a play of numerous hormones, right? That is important. Even love has dopamine, serotonin, oxytocin. Happiness has its own hormones. These two, three hormones are playing an important role in that. In anger, we have a different hormones. In depression, anxiety, and we all come across stress. So the first thing I want to say is stress is part of life, and we should always try to adapt to the stress. Okay, चिंता जो होती है वो चिता होती है, तो चिंता ना करे, चिंतन करे. Okay, that is important. We have to deal with stress. Everybody faces the problems of stress. Now, as we all know, our hormones are governed by our limbic system, which regulates our hormones. A fine balance between the hormones creates an equilibrium and a state of health, right? If this equilibrium gets disturbed, okay, then there is a hormonal imbalance. Stress is starts creating problems, and different hormones release different aspects of the changes that take place in our body. So there is release of serotonin, there is release of adrenaline, noradrenaline, and insulin is released. So stress has all this these changes that takes place, psychoneurohormonal axis that I talk about. And first of all, that I want to say, nobody wants to have an autoimmune disease. Okay, autoimmune disease, when the body attacks itself, right? When the self cells are not recognized, each cell, they try to fight against each other. They don't recognize that they are the same part of the body, right? They start when the body starts attacking itself. So autoimmune disorder, whenever we talk about, there is mainly that we have to understand is we need to treat the cause and not the symptoms. So cause is important, and understanding the cause of the disease is important. How it started. in Kent repertory, there are so many rubrics which are starting from ailment from, right, and causation from. Okay, so those rubrics are very important. If we get a good exact cause of the disease, then even your case is, just understand that it is half treated, right? So that is important to understand. To find the cause of the disease is very important, and interpreting it into the proper rubrics. Okay, that is very important for our totality. Systemic inflammation that takes place in autoimmune disorders and tissue attack itself, and there are so many autoimmune diseases that we come across nowadays: rheumatoid arthritis, it's ankylosing spondylosis, psoriasis, vitiligo, SLE, and so on and so forth. So autoimmune disease is a forte of homeopathy, and I I want to tell to everyone that homeopathy has the best answers to autoimmune disorders. Now, our root cause of autoimmune immunity, body, is infection, trauma, hormonal imbalance, and so many factors are there. Emotional stress, toxins that we take, and so many things. And causes of autoimmunity is genetical, environmental factors, and endogenous factors, which is shown in the slide. So these factors combine, and they create a imbalance in the body, which leads to autoimmune disorders, right, like psoriasis. So this is the normal immune response that we come across. An invader like a virus enters, immune cells called lymphocytes, they attack to the viruses. In autoimmune diseases, the immune system creates antibodies that attack your own cells. That is important. Okay, and thus the autoimmune disorder come across, we come across all this. So autoimmune disorders are always affected with extremes of weather, especially cold of weather and hot weather, right? If you'll see, psoriasis is generally a disease of winters. It's a disease of dryness. It's a disease of silvery white flaking, right? When there is dryness, then the excessive amounts of flaking takes place, right? So that creates excessive scaling, and psoriatic patches thus they develop. So in the same way, even hot weather also, we see in hot weather the autoimmune disorder also aggravate joint pains, thyroid, skin problems, lupus. So there are extremes of weather. Autoimmune diseases creates a lot of problem and gives origin or aggravates the situation, right? So in the same way, autoimmune diseases, there is common symptoms are there: trouble concentrating, low-grade fever, numbness, tingling, skin rashes, swelling, redness, and fatigue. And you can see autoimmune diseases, organs of the immune system. Tonsils are affected, adenoids, white blood cells, lifestyle changes affected, SLE, bone marrows. There are so many things that come into the play of autoimmune disorders. And there are various autoimmune diseases possible cause risk factors, right? Like diet, like Western diet, fast food, genetics, age factors, environmental factors, and so on and so forth. I have one thing I want to reiterate here is Koebner phenomena is the most important in psoriasis that we should understand. We should tell the patient that Koebner phenomena is because of the traumatized, uninvolved skin of patient who have psoriasis, like lichen planus, psoriasis. If we scratch the skin, because of the injury, because of the trauma, the lesion starts developing. So where there is no psoriatic patches, there also they will start developing. So Koebner phenomena has to be explained very well to the patient. Okay, so they should avoid scratching. They should avoid physical injury, chemical injury. Okay, that is important for every patient to understand. And trauma can be physical, laceration, bites, burns, everything. Allergic conditions, like hair color is a good example. So many chemicals, bleaching agents, these things are to be avoided in Koebner phenomena. And we all know psoriasis are incurable chronic skin diseases as of the modern medicine. I want to reiterate over here is this slide is for as per the modern medicine, but our homeopathy has got specific answers, and I have treated so many cases of psoriasis. Even the the treatment of those patients have been stopped. So I'll show you all the cases with evidence that so many homeopathy has got exact answers for psoriasis. So 125 million people are affected. You know, it's a large part of the population which is suffering from psoriasis. And burden of psoriatic arthritis, Crohn's disease, ulcerative colitis, psoriatic arthritis. Psoriasis is just not a disease of skin. It has psoriatic arthritis also. It leads a lot of people for depression, reactive depression, suicidal ideations, and alcoholism, and so on and so forth. I'll tell you that even the plaque psoriasis has generalized psoriasis, and planto-palmar psoriasis is also very common in these. The first case I want to show is psoriasis with secondary infections. Okay, I will show you, this is the first case, and you can see how the patient is leading his life: itching, oozing, fluid, excessive scaling, and there is extreme pain, rawness, and aggravation washing, and aggravation dryness. So I just want to tell you, just see the condition of the patient and imagine how this patient is leading its life. Okay, it's so tragic. It's just not psoriasis. Psoriasis with secondary infection is also very dangerous and very very crippling. I can tell. The patient cannot go to the loo. The patient cannot go to the washroom, and this patient, young girl, and she's not able to go to the for her job, and so on and so forth. So you can see the picture speaks for itself, and you can see when the repertorization was done in this case, certain rubrics were taken by taking the whole case. Okay, here I want to tell you that each and every case is a long case, right? So I want to tell you that each and every case has taken a lot of time, but I want to show you maximum number of cases. So I have clubbed it into a short prescription which I have given it according to the constitution. So there is no shortcut to the success. Okay, every case has to be taken. Every case, mentals has to be taken, causation has to be taken, and proper repertorization has to be done to get the exact result. Okay, so we in this case the rubrics were selected, and in this case, timidity, yielding, irresolute, consolation, aggravate, delusion, hears, okay, voices, right? Delusion, talking to the dead grandparents, this was there. Cowardice and perspiration, palm and soles were there. Okay, so mentals were there, physical generals were also there, and we have to understand that physical generals are very important in our prescription, right? Mentals, rubrics, your interpretation and my interpretation can be different, right? But our physical generals will never change. So I give, and I all advise everyone to give importance to physical general, because if the patient is hot, it will be hot for you also, it will be hot for me also. If craving is for sweet, so it will be it will be like for you also, it will be for me also. It's like a milestone, right? That cannot be changed or misinterpreted. Mind and mental rubrics can be misinterpreted, or your interpretation can be different, my interpretation can be different. You can use some other rubrics, I can use some other rubrics, right? So physical generals very important in this case, and repertorization chart was prepared, repertorization was done, and you can see so many medicines have come up according to the repertorization. You can see that this patient is timid, yielding, indecision, and important thing is cowardice. Okay, that is the main thing. So we have got the first medicine, Calcarea silicata was given, Natramur, Ignatia, Lycopodium, Scipia. Okay, we all know that timidity, yielding, and cowardice are a prime of Calcarea and Silicea, right? So as of now, seeing this case, Calcarea silicata came first. Just not because it has come first, we are not giving like that. Okay, the constitution of the patient says that this patient is timid, yielding, indecision, and there is cowardice, right? And on top of that, it's like these things come across, and then we see that Calcarea silicata was given in this case, and follow-up was there. This is the first follow-up, and you can see the oozing, itching, the patient has started feeling better, and the the patient is much better even in the mental aspects also. So the oozing has reduced, the itching has reduced in this first follow. Now coming to the second follow, you can see the main oozing has really stopped, okay, and itching has considerably come down, and there is no pus formation, so there's no suppuration, right? And you can see the patient is much better. And still the first and this second follow, the patient, I have taken the case history by the on the phone, and her parents have come. They were suggesting me whatever the kind of personality the patient was having, right? So this was the second follow. Now second follow-up, you can see it is much better. The patient has reduced, and you can see in the third follow-up there is no oozing, there's no itching, there is no pus formation, and you can see third follow-up the patient have improved a lot, right? So in this case of secondary psoriasis with secondary infection, and you can find that very, very nicely in the fourth follow-up, the patient improved and patient came directly to the clinic. Before this, all the photographs of the patients were sent to me via, by the parents of the patient. But in the fourth follow-up, this follow-up, you can see the patient has itself come to the clinic. She was feeling much better, and she has come to the clinic, and you can see what a great improvement has come. The patient is able to walk, the itching has reduced, the pain has reduced, and even there's no suppuration, there's no oozing, and patient is much better. In the fifth follow-up, you can see the patient is even more better, and she's able to come to the clinic by herself, right? And this is the fifth follow-up, and you can see before where we started and where we are, right? So this is the before after photograph which is there, and you can see what tremendous improvement is there, and how beautifully simple medicines Calcarea silicata has helped the patient in such a big way, right? The important thing is the lifestyle, the quality of life of this patient has improved. So this is important to tell you. I've started this case, I have shown this case most of the places, because this case is the patient was suffering so much. You can see the photograph speaks for itself, right? So this is important. Now coming to one more case, I want to show you so many cases of psoriasis that you will feel that homeopathy has great part to play in psoriasis. In the same way, this is a model case of 38 years, 38 years male, and this patient used to come from Basti, right? Farmer, and you can see the extensive psoriatic patches of this patient. I mostly show this case in most of my presentation, because I have not seen, and I have not seen other doctors also, showing such extensive psoriasis, right? That is the reason I show this case mostly, because I have not seen such extensive psoriasis in any patient. And you can see this patient has also tried to commit suicide, right, for 4 times, okay? And just see the quality of life this patient is having. Even in this case, I tell you one clinical tip I want to tell you. If the case of psoriasis is there, please get the serum uric acid checked, right? Serum uric acid is mostly raised in these cases. Second, please get the CRP test. CRP is mostly raised in these cases, okay? Once the patient improves, even the uric acid and the CRP comes down, normally, right? So you can see how the patient is crippled. This patient was so, financially, he was so poor that he can't even, the condition of the patient was that his, family used to say, his brother used to come and tell me that, Doctor, if this person dies also, it was his brother, real brother, and I can't imagine a brother saying something about his real brother कि डॉक्टर साहब ऐसी जिंदगी करने से अच्छा है ये मर जाए. These were the inverted commas words that I've heard from his real brother, right? So this was the condition of the patient, and very bad the situation was. The photograph was taken and brought to my clinic by his brother, and you can see his abdomen any body part which is not affected, it's like how this patient is living a life. You can see his back, right? How his back is there. Any part, not a single part of the body is left, right? Even in hairs are coming out, and there's so much of scaling on the head also. And keynote symptoms when this patient was the photographs of this patient was brought to me by his brother, and I talked to him. I came across a keynote symptoms. I gave him I took just keynote acute prescription. I did, okay, in the first meeting, because the patient was not there, and whatever I could gather from the telephonic talk, right? So I gave a acute medicine, because the dry, wilted, emaciated crust formation was there, and soreness was there, intolerable itching, stinging, burning pain. I gave him Kali Arts 30 single dose, okay, just on the basis of acute prescription, right? So when Kali Arts 30 was given, and you can see the patient has improved much, and there is a lot of improvement. The lesions have dried up, scaling has stopped, oozing has stopped, and the patient has come to the clinic. This is the photograph of my clinic, right? So this is, you can see that the patient has improved from the first photograph, right? And this is, you can see the back, you can see the abdomen. Things are better, and it is better. Then only the patient has come all the way from Basti to Lucknow to my clinic by himself, right? So this disease has got so much of stigma attached. Nobody will sit next to you. Nobody will, touch you. While traveling from a public transport is so difficult. Things are oozing, and so you can see the condition of the patient, but still the patient was feeling better. So he came to the clinic, and he was feeling much better mentally also, and physically also. And the suicidal ideation have reduced, right? So when he came to the clinic, then I took a proper case taking, and what I came across was very astonishing. He has a great fear of snakes, delusion of snakes in and around her, fear of snakes, and dreams of snakes, okay? And he was so frightful of snakes that he used to tell me, Dr. Saab, if I go to my washroom also, then also I feel that, is there any snake around me? Delusion, snakes in and around him was marked in this case. And this person was very timid, very irresolute, very confidence lack of, these things were there. But I just took the ailment, and I took the higher mental symptoms only. I prescribed only on this basis. See, I told you in the beginning, if we get the exact ailment, and if we get the exact mentals, just no point taking the rubrics, like 10-15 rubrics which are not accurate. If you get PQR symptoms, okay, peculiar, cure, rare, and strange symptoms, they are the best symptoms. So mental higher general symptoms are very important. In this case, there was a fright once he was returning from his field, okay. He's a farmer, and he was returning from a field, and he came across a snake, okay. And but in villages, coming across snakes is very common, right? But this person has so much of impression of snake that he developed delusion also, fear also, and dreams also. And that is very consistent in this case, okay. He was continuously dreaming of snakes, his fears of snakes, and delusion. So this was a very consistent feature in this personality of this patient. And I just took these only 4-5 this thing rubrics I took. And see, one thing I want to tell you is, repertory is just suggestive, right? Repertory is always suggestive. It will give you 10-15 medicines on top, but that doesn't mean that the first medicine that which is coming or second is coming, you have to give that only. No, repertory is just suggestive. The final quote of final quote of justice is materia medica, right? So you have to understand that whatever the medicine comes in your repertorization, the constitution belongs to which medicine, right? So in this case, the patient was timid, very confidence lack of, and very irresolute, and very fearful, yielding. These kind of patient was there. Okay, so when I came across all these things, then calcarea carb I came across, and I gave him calcarea carb in this case, and you can see the patient has improved beautifully by this. This is the first follow-up photograph. You can see how his abdomen was there. Okay, see his legs have totally free from any lesions. Legs have actually improved very well. You can see the back. This is a second follow-up. Back has improved, abdomen has improved, and his fear and delusion of snakes has reduced considerably. Dreams have come down. Dreams have almost gone. Okay, so this has to be there. And you can see the before photograph and after photographs. How beautifully. I show this case because this case is important, because this patient has lost all his hopes. He has gone to the best of the dermatologists, best of the homeopathic doctors in the Uttar Pradesh, and even in Lucknow. So many big doctors are there, renowned doctors are there. But this case improved beautifully. And I show this case because the extensive psoriasis you can see only in this case. Extensive, no body part is been left, right? So uric acid has improved in this case. CRP was reduced in this case, and the patient improved very well. You can see before his back and after, and the patient has improved very well, right? You can see. Now coming to the another case. See, this is a case of psoriasis, and you can see with secondary infection only on the foot, right? And you can see the condition of the patient: intense agony, oozing, watery discharge, pus formation, bleeding, and lots of cracks, right? You can see itching is there, aggravation, washing, everything. The quality of life is been very poor, and the patient is almost crippled in this case. And you can see the condition of the patient. She's a teacher, and she is not able to go to the school where she's working, and she's just confined to her bed. She's she can't even go to the washroom, and it's a very tragic situation. And in this, how this homeopathy has helped her, you can see it's a long mentals were taken by me. And the main thing I want to tell you in this case was indignation. Indignation is like what you have to do against your dignity, right? The principal of the school has somehow forced her to do something which was she was reluctant to do. Okay, she did not want to do that, and because of the pressure of the principal, she had to do it. And from there, that indignation has come. She's a very self-respected, she was having a lot of self-respect, very egoistic lady, and a very nice lady, very image conscious, what people will say about her. Okay, and she always very depressed and very sad, and she was that kind of a person. Okay, and but the main thing about this case was indignation, right? So indignation was marked in this case, and anger suppression, egotism, abrupt. She was very abrupt, straightforward. Okay, she used to say whatever is there, but certain situations she had to in certain situations she was forced to do things which she was not willing for. Okay, so in this case, fear, humiliated of being sensitive to what others say about her, all image conscious, right? So I always say this, that दुनिया का सबसे बड़ा रोग क्या कहेंगे लोग, right? So fear is there, right? Sensitive to what others say about, right? Image conscious, right? She was so image conscious. And you can see repertorization was done, and the prime medicine for indignation is, you can see it has come second, and that is Staphysagrija was given in this, especially this female patient, very sensitive, in the same way egoistic, and Staphysagrija was given in this case. 1M was given, and you can see the second follow-up, how beautifully the oozing has stopped, the cracks have stopped, and the bleeding has has reduced, and the patients have improved very well. And after that, Saclac was given, and you can see there was no point, no need to repeat the medicine. And this is a 2012 case, right? Third follow-up, you can see how beautifully the cracks have improved. No oozing, no pus discharge, no itching, no burning sensation, and no recurrence of any disease. I want to tell you something about recurrence. According to World Health Organization, if psoriasis, right, psoriasis does not have any recurrence for 5 years, then only it will be said cured, right? Most of the cases I'm showing you is more than 5 years, right? So, and with no recurrence. So that is important to understand, that I have tried to show you cases which I have got more follow-up than 5 years, right? So you can see before and after photograph how beautifully the patient has improved. Coming to the next case, you can see the patient full body psoriasis. There's no body part that is left. This is the patient came to my clinic, and he was a farmer, and very stout guy. And you can see his back, his hands, and you can see how every part of the body was affected. And the patient came to the clinic. He sat in front of me and he started crying that Dr. Sahab, ab to jeene ki koi tamanna hi nahi hai. How what kind of life I'm going to lead? And it was very pathetic situation. But life space was there, anger suppression was there. He was living in a joint family, and his father, father, mother, and joint family were there. And after the death of his parents, he had six brothers, which during the separation of the property, he got the elder brothers have overpowered him and given him less this property was given. And he could not say anything to his elder brothers because he was younger. Okay, he did not want to disobey his elder brothers. So there was a lot of anger suppression in that. He was dominating person. He was dominating, egoistic, abrupt. These things were there. He was very strong person. But during his partition of the property, he got very less amount of property in the separation. And because of that, anger suppression was pronounced. And because of this suppression, he had to undergo a lot of trauma, mental trauma. And certain rubrics were taken in this case: anger suppression, dominating, egotism, contradiction intolerant, offended easily, ambitious, lack of confidence, and while speaking in public, cowardice. Okay? These rubrics were taken in this case, and repertorization was done. And as we know, anger with cowardice, I want to explain this. If a person is dominating, egoistic, okay, offended easily, ambitious, but on the same time cowardice, this is a typical feature of lycopodium. Okay, on one hand, the patient is very dominating, very egoistic. On the other hand, he is cowardice. On certain situations, he becomes very cowardice. He is not able to express his feelings, right? So he has to keep quiet. That is anger suppression in this case, right? And because of this case, lycopodium is a typical of where the personality is dominating, but in certain situation, the patient used to behave like a cowardice. These both go hand in hand, and lycopodium was given in this case. And you can see the second follow-up is there. How beautifully the abdomen, you can see the back, hands, you can see beautifully. This patient, all these patients I'm just showing you because these cases are well followed up. Secondly, they have extensive psoriasis. Thirdly, these patients are very poor patients, right? If we can make change as a homeopath, if we can give them relief, if we can give them some good quality of life, only it'll be great help for the humanity. So I have always psoriasis has always been close to my heart. I have always worked for psoriasis, and because I can say I have got amazing cases of psoriasis. I can show you n number of cases on this, and I'll show you some recent recent cases also. These cases are well followed up. You can see before after. You can see his hand, before after photographs are there. You can see the stomach and the abdomen. Okay, everything. Abdomen has cleared up. No lesions are there, and there has not been a single, recurrence till now. Okay, you can see before and after how beautifully the things are resolved. Now, coming to the next model case, you can see the condition of the patient. This case is I have putting you because psoriasis generally occurs on extremities, abdomen, back. On the face, it comes very less. Rare of the rarest cases, you will see psoriasis on the face. Okay, when it is extensive. So this case I have got it because it is a 2022 case, right? This is a new case, right? You can see the psoriasis on the face is rare. So because of it's rare, that's I've got this case for you. And you can see rubrics: ill health of mother, long-standing grief, brooding, loathing of life, forsaken feeling, dwells on past disagreeable occurrences. The patient keeps on reminding the past, which has not been good, which has always troubled him. He keeps on thinking about his past. This is what's important. He was very lonely. He was very timid, very shy, and very introvert kind of reserved kind of a person. And you can see desire salty food and sun aggravation, right? This is important to understand. These two physical generals are important. They are defining the case, right? It is showing that the patient is towards negativity, brooding, grief, long-standing grief, loathing of life, all negative characters. Pessimistic characters are there in this case. And you can see repertorization was done. Aurum-mur, natrum, and natrum-mur was, coming very close to, because desired salty food and sun aggravation is obviously is showing towards natrum-mur. So natrum-mur was given in this case, and you can see the second follow-up, how beautifully things have started resolving. This is the third follow-up. The scaling and all these things, the itching has reduced. Only the redness is there in the third follow-up. Marked reduction in size, severity of psoriatic patches on face have reduced. Moreover, patient is mentally also seems to very calm, composed, and anxiety has reduced. Right? This is the beauty of homeopathy, that we don't only treat the skin psoriasis, the patient gets better overall. Even the mentally the patient feels better. And you can see the fourth follow-up, and the patient has improved totally with no recurrence till now. This is 2022 case. Still follow-up is there, and the patient is no recurrence has been noticed in this case. Coming to the next case, you can see this case. This patient used to come from Sidhauli, okay, a place close to Lucknow, and you can see full body psoriasis is there in this case, and he's having, with lots of plaque formation, redness is there, right? I want to tell you 2-3 things. First is when you treat psoriasis, if the lesions are becoming towards red, okay, if they are fiery red, that means the case is not improving. I want to reiterate this. If the redness is there, that means the case is not improving. If the case is if the case is becoming black, it is drying up, redness has reduced, blackness has come, that means the case is improving. First. Second, in the clinical thing, I want to tell you, many patches, they join to form a big patch, right? This happens very commonly in psoriasis. Many small patches, they join to form a big patch, right? And when you give the medicine, the patient improves and the lesion improves from the in between, okay? And it improves like a flower, okay? The margins go, at the end, right? The patient improves, the skin improves from center to periphery, right? That is important to understand in psoriasis. And the borders of the patch goes later on. So these things are very important. And the Koebner phenomena, the patient should be told not to scratch these things. And this is it's a disease of winters. Okay, So proper application has to be done. Proper, oiling can be, moisturizing is important in this case. And a soap which is a glycerine soap, right? Glycerine soap is always helpful in this case. Okay. So this is important because, and if patient is exposed to a good sunlight also, sometimes moderate, not too much, moderate. It's helpful because in winters, this case, psoriasis, worsens in winters. If we give, heat to the body, not too much, okay, not too much, a little bit in the winters, not in summers, in the winters, then it improves, right? So coming to this case, physical generals were taken in this case. Rubrics were sympathetic, affectionate, clairvoyance, company desire for, sentimental, anxiety for the others, desire ice cream, but also aggravates. He always used to desire ice cream, desire cold food. This was the marked in this case. And rubrics were taken, repertorization was done, and you can see in the first, phosphorus was coming. So we know that phosphorus is very affectionate, sympathetic, and very sentimental, and always, concerned about other people, right? He's very emotional person. And in the same way, physical generals were were taken in this case. Ice cream, desire, but also aggravate. This is important of phosphorus, right? Desire cold food, then also aggravate. Okay, that is important to understand. Phosphorus was given in this case. This is the case of 2016. Phosphorus 1M was given. This is the first follow-up you can see. Second follow-up, and from there you can see third follow-up. The patient came to the clinic, and you can see the patient has improved totally. You can see it took almost 1.5 to 2 years, this patient, for to all the lesions to go. First, second, the follow-up was even more. 4-5 years follow-up was taken, and no recurrence was seen in this case. And you can see before and after photograph how beautifully even the pustules have started becoming, coming. Redness has decreased in this case, and the patient has improved very well. Now, coming to one more case, you can see the whole body psoriasis in this case. See his hands, see his back, okay? Extreme sensation of dryness, stretching. When there is dryness, there is stretching feeling in this. And in the same way, you can see rubrics were taken: timidity, forsaken, anxiety, anticipation, fear of public appearances, intelligent, delusion, everything will fail. Obstinate, right? This is important to understand, that the patient was obstinate, and repertorization was done, especially image, fixed image, and image conscious. I told you, image consciousness is important, and perspiration, palms and soles, fixed ideas, and obstinate, and intelligent. All this silesia was given because of his image conscious, right? This is the first follow-up. This is the second follow-up, third follow-up, and you can see before after photographs. See his back, how he improved. See his legs. See one more case. This patient, young chap, 26 years old, lots of psoriasis, especially on his face, right? And people used to, his friends, he does not used to go to college because his friends used to say that you are Hanumanji. They used to taunt him like that. And you can see whole mentals were taken in this case. Coming directly, physical generals were very important, and craving salty food, hot patient, and perspiration, sweats, head, palms and soles. But the rubrics were grief, death of father. This was the long-standing grief, brooding, loathing of life, forsaken feeling, and cannot cry in front of others. This is a typical of Natramur. We all know Natramur is not like Pulsatilla. Pulsatilla can cry anywhere. Natramur only cries, when cannot cry in front of others. In a lonely place, he used to go and cry. Okay, and negativity is there, introvert, reserved nature, no friends. These things were there, and desire salty food, and repertorization was done in this case. And you can, Natramur was given. You can see the first follow-up. Oh, yeah, this is the third follow-up. You can see this is the before after. How beautifully this patient improved from he used to be, you know, scolded by friends that you are a Hanumanji, and see this from this photograph, we can't even make out that he's having a psoriasis, right? So this is important to understand what homeopathy can do in psoriasis. Coming to the latest case, this is a latest case I want to show you. Is you can see the condition of the patient. The female in this case was, extreme scaling, silvery white, typical silvery white scaling on her head, with extreme itching, and lots of pustules were there, oozing was there, itching was there. The condition was very bad, and she had gone to the best of the dermatologists, best of the homeopathic physicians in the city, but this patient did not get relief from anywhere. You can see how the, she used to touch her hair, and her hair also used to come out. You can see the condition. Left side of the nape of the neck, you can see, and the right side behind the ears, and whole head. It's a latest case I'm showing you, that that whole of the head, it's a kind of plantar palmar psoriasis. One thing I want to tell you, important thing is that we have to understand what in this plantar-palmar psoriasis, the scaling starts from the hard part of the skin. Hard part, like normal skin is this, right? Hard part is this. This is the hard part, right? Palms and soles and the head. Head also has a hard skin, right? So hard skin is first affected in this case, right? So in rubrics were taken in this case: confusion of mind, lazy, mathematics, inapt for sympathetic, artistic nature, emotional, desire, cold food, cold drinks, consolation, amulet, and desire to travel. These things were there, but main constitutional symptoms were confusion of mind, lazy. She was very poor in mathematics, and artistic, sympathetic, and these things were there. So calcarea phos came out. Although the calcarea phos is down under in the repertorization chart, but because of the constitution, I'm talking about the constitution, travel, desire to, right? And consolation, amulet, desire, cold food and cold drink, artistic nature. She was very good in singing. She even used to draw a sketch, do a sketching and all. Okay, so this was there. And on the same hand, on the other hand, you can see she was confused also, lazy also, and irresolute also, timid also. So this was the combination of things which was coming to making it, after repertorization, it came to be a clear-cut case of being sympathetic, having phosphorus symptoms also, artistic, sympathetic, emotional, and desire, cold food, cold drinks, right? So then calcarea phos 30 was given in this case, and you can see not even a single patch is left. Okay, the patient improved very well and very fast also. This is the latest case of 24, right? This year only. And in February, the patient improved very well and with no recurrence till now, right? 15/4, and you can see the patient before and after. So you can see how beautifully things have improved. So in the end, I want to just tell you that homeopathy has got great to do with in dermatology, especially in psoriasis, especially in autoimmune diseases. And I tell everyone that in autoimmune diseases, homeopathy is on the forefront. And the first thing I want to tell you is, and to all my fellow friends and my students and all the teachers, that we have to take homeopathy to the masses. Okay, we have to show all these cases, and then only we will be able to tell that homeopathy can do a lot in dermatology, and especially in autoimmune disease and psoriasis, vitiligo, SLE, and so on and so forth. So last words I want to tell you, some encouraging words for everyone. फेलो होम्योपैथ, जिंदगी की असली उड़ान अभी बाकी है, जिंदगी के कई इम्तिहान अभी बाकी है, अभी तो नापी है मुट्ठी भर जमीन, अभी तो पूरा आसमान बाकी है. Thank you very much. Thank you, International Forum, for promoting homeopathy, for giving me this opportunity, and for presenting my case and presenting my research. Thank you very much, Dr. Dhanesh, Dr.
Yes, sir.
Tahani, sir. Thank you very much, sir.
Thank you, Dr. Nishant. Srivastava, you really rocked on the floor with the wonderful cases, and that nobody could believe that such things can happen with single medicine, and that too the classical methods. Because not only single, one or two cases may have. Some people may get one or two cases in totally cured, but in these cases, almost all cases were not only never even palliated, but just cured. That is, the word cure is more prominent in your presentation. Nobody could believe that such things can happen with this single pellets or homeopathic medicine, and that too with the centesimal potencies itself. And have you anyway, since there is a very few time to discuss, we have to cut short the discussion. Anyway, we will definitely upload this video tomorrow itself so that it will reach to the public, and public will aware about the scope of homeopathy in this, so the so-called cases, incurable cases, particularly the cases that is autoimmune diseases. Homeopathy can do wonders, and you really deserve a big award rather than a simple award. That's what I would like to add. And our button, Dr. Sridhar Kurur sir, is here to have a chat with you. Since the time is less, we are going to Sridhar Kurur sir directly. Yes,
Yes, Dr. NISHANT Srivastava, it was wonderful.
Thank you.
Excellent. I appreciate you. Please come some other, you are not finished. You may have so many other cases also. Come the next time, because lack of time, I'm not going to say anything else. Thank you very much. Wish you all the best.
Thank you. Thank you very much. Thank you for this opportunity.
Come again.
Yes, sir. Sure. Definitely. Whenever IFPH will call, I'll be there, sir. Thank you, sir. My pleasure.
Dr. Ram Prasad.
Thank you, Danesh ji. Congratulations, Dr. NISHANT Srivastava.
Thank you, sir. Thank you.
Salute. Psoriasis case, incurable case, easily treat according to homeopathic medicine. Beautiful होम्योपैथी, ब्यूटी होम्योपैथी, है ना। तो बहुत अच्छा लगा। आपने लिखा भी कि जिंदगी के अभी भी उड़ान बाकी है, नापी है मुट्ठी भर जमीन, लेकिन आसमान अभी बाकी है।
आसमान बाकी।
जय होम्योपैथी, जय होम्योपैथी। थैंक यू, वेरी नाइस presentation.
And now I invite Dr. Bob Lim to say vote of thanks. Dr. Bob Lim, I couldn't find out. Please. Minute. It's not. Please raise your hand. So tomorrow also we will have a session from. Before closing, I have to announce tomorrow's presentation. Tomorrow we will have a presentation from Dr. Lubna Kamal, MD Homeopathy and MBA PhD, and the subject is the importance of what call. That is the importance of World Health Organization Quality of Life Questionnaire in Homeopathy. That's a very important subject also. Tomorrow, as you all know that. I know such a wonderful session from Dr. NISHANT Srivastava. Really, NISHANT Srivastava has really thrilled us with beautiful cases, and hope this doctor can present some more presentation in the coming month in our edition of a webinar. Definitely, we will go with some great cases again and again, so that our purpose of forming such an organization is connecting between the doctors as well as promoting homeopathy to the public. And this is this kind of presentations really do good than anything else. Thank you, Dr. NISHANT. And
thank you very much. Bye.